Friday, January 18th, and it must be time for another legislative update from your North Carolina Medical Society. We're not quite to session yet. We don't start until next week. But we told you last week that we're going to talk about what we're prioritizing for the coming year. So here it goes. First and foremost, the Legislative Cabinet has approved a list of things that we're going to lead on and things that we're going to play a support role in. Those two lists are going to our Board of Directors this weekend for final review and approval. So next Tuesday in your morning rounds, your new daily update from the North Carolina Medical Society, one of the stories in there will have the full detailed list. Right? So we'll start with the details there, but we want to give you a little highlight today. So the first thing is something innovative.
You're right. So specifically listed out, which is something new that no other medical society in the state has done, is prioritizing health over paying for health care.
Right.
And we're really proud of this initiative because we think it's so innovative and a great way to exemplify leadership in medicine.
Yeah, this is something that we've been doing through our program work, through the various projects that we worked on for years, where we're putting patients first, because of course that is our mission statement for the North Carolina Medical Society, to improve health in North Carolina. And we just feel like that needed to be something that was expressly stated this year, and the Legislative Cabinet agreed, and we think the board will agree to that also. Right behind that, in importance to tell you, is that we've listened to you. And many of you have participated in the snapshot surveys over this last year, and those have been so helpful to guide us in what we're doing from month to month. And one of the things that you said is that genuine patient safety issues are a top priority for you. So scope of practice, as always, is going to be out there. We expect 4, 5, 6, 10 different bills that we're going to have to analyze. So that will be a top priority that the Medical Society recognizes that we've got to step up and take a lead on.
And something else that we also listened to you on that made the list is public health. So that includes water, helmets, seat belts, all of those issues that you have asked us about and asked us to spend a little bit more time on and publicize is on our lead initiative list as well.
That's right. And a lot of those things we've been working on for years, especially where they have budget implications. We've been very involved in those issues, but not something that we've talked about as much, so we're going to be talking about that more. In addition to that, insurance, always a huge issue. Some of the smaller items underneath insurance aren't always as popular as others, but increasing access to affordable health care is a top priority for us, as it has been in years past. Making sure that it's less complicated for you and your patients, another big example of what we're going to be pushing for this year. And then, a couple of other things like defending med-mal reform. This little thing that happened in 2011 that everybody seems to have forgotten about, we still have to make sure that we're keeping those reforms and making sure that you don't have to practice defensive medicine so that we can put value first and foremost.
Of course, that stays at the top of the priority list.
That's right. That's right. So that's kind of some highlights. Like I said, there's going to be more detail coming out next Tuesday for you to read in detail about that. But looking forward to next week. We're going to be starting on Wednesday. We already have our president, Dr. Tim Reeder, is going to be in town visiting for the opening day of session. We've got a White Coat Wednesday scheduled already. If you haven't yet done that, call Sue Ann. And then next week when we come back to talk to you, we're going to give you a way to start off that conversation for the year with your legislator, both talking about our legislative priorities and just opening up a dialogue to continue that relationship that you've already developed, or if you haven't developed them because it's a new House member or a new senator, we're going to give you that opportunity to open that conversation up. So we hope you have a great holiday weekend. Do something good for somebody else, and we look forward to talking to you again next week.